Have you ever had an ocular migraine or a headache of your eyeball? In this video, we're going to be talking about ocular migraines, what they look like, how they can present, what you need to be aware of, and some things you want to watch out for with them. So, you may have gotten some migraines and headaches that are limited to the head, the brain, the cranium, anywhere in that region. But what about the eyeball specifically? What's it like when the eye gets a headache? Because it can get a headache, commonly known as an ophthalmic migraine or an ophthalmoplegic migraine, which is not intractable, which sometimes means that we can't find a cause for why it's happening. But there are two schools of thought with what happens for how an ocular migraine occurs. So, when an ocular migraine occurs, there are two theories out there. They're just theories. We can't always prove these to be 100% true, but there are some questions that get to be asked if we think that one of these theories may be coming to light related to some health conditions. So, theory number one is that oftentimes it may be related to a temporary blood pressure change with the blood vessels in the eyeball compared to the rest of the body. So, your eye has blood vessels, veins, arteries, capillaries, just like any other tissue throughout the human body. And what happens is sometimes the blood pressure may be a little bit different, whether it's higher or lower in the eyeball compared to the rest of the body. And the brain tends to freak out a little bit because it needs the blood pressure to be the same in all blood vessels at all times, basically. So it tries to regulate that blood pressure in order to get things to come back to normal. But sometimes the eye can send weird visual signals to the brain or visual auras, phenomenon, broken glass, color vision changes, or anything like that, like kind of tunnel vision looking effects to let the eye lets the brain know that there are things going wrong and that they need to be corrected and modified. That's one theory. The other theory is that it may be a hormonal imbalance or a hormonal change, or maybe there's new birth control that you're on. Maybe it's some type of thyroid problem. Maybe it has to do with pregnancy. Maybe it has to do with some level of hormonal exchange between the eye and the rest of the body that is not lining up appropriately, which can sometimes affect the calcium gated voltage channels along the optic nerve. And they all send different signals and can kind of create that visual aura phenomenon as well too. So it's hormonal or blood pressure related are the two main theories out there. There are other things that can trigger ocular migraines like stress, lack of sleep, excess caffeine, lots of computer work and eye strain, reading. These are things I'll ask my patients a lot of times, just some questions that we need to kind of walk through to figure out what can be some identifiable triggers for what allow the ocular migraines to develop. So when I talk about ocular migraines, you may have heard me mention, what are these auras you're talking about? What is this broken glass? What are these changes in color? Anything like that. So when we talk about the auras just typically refer to things people see in their vision. A more common one that I typically hear a lot of times has to do with jagged pieces of glass, or like almost like heat, like you may have seen heat coming off a sidewalk on a hot summer day. It kind of looks like heat waves rising or broken glass, or it can look like tunnel vision kind of closing in on one or both eyes, kind of pretty acutely. Or it could have to do with some color vision changes. Sometimes some patients will be sitting in a dark room and they'll see these red and green flapping bars at the top of the ceiling. There's a whole bunch of weird things that can happen with the vision, but usually ocular migraines last anywhere between about 3 minutes and 45 minutes. I mean, that's kind of a loose range. A lot of patients can experience symptoms and they typically resolve after that. Now, if you experience these migraines or visual auras or something different for like several hours, we're talking like 6 hours, 12 hours, 18 hours straight, or just weird things like headaches that are waking up in the night, or a whole bunch of different stuff that happens, that could be a different animal entirely. That could have deeper neurological involvement that you'll want to contact your physicians about, just to get some questions answered, maybe get some tests ordered, maybe a CT or MRI to start ruling some things out, or just see what's going on there. Because ocular migraines don't usually last the span of a couple of hours. They're usually anywhere between 3 and 45 minutes, and it varies roughly somewhere in between them. On average, I hear probably less than 30 minutes for most patients, but sometimes an extra 15 minutes can hang around if someone is experiencing this visual phenomenon that can sometimes alter the vision in strange, weird ways like that, and it may be lasting longer than anticipated. But those are ocular migraines, and again, you can have caffeine, lack of sleep, increased amount of stress, whether it's emotional, mental, physical, or anything like that, that could be putting excess strain and stress on the eyes, too much reading, too much computer work, um, things of that nature that can really mess with the reading vision for what you're trying to see off in the distance or read up close, or even just function at an intermediate distance. And if you think you may have identified a trigger, make sure you talk with your local eye care professional just of different ways that maybe you could decrease the amount of stress. Maybe it would help if you go for a walk outside. Maybe it would help if you picked up a different hobby that didn't involve as much intensive reading. Anything like that could be very beneficial and helpful to lower the amount of frequency that you experience with ocular migraines. And if it is hormone or blood pressure induced, again, you want to talk to your eye care professional as well as your main physician in order to get some questions answered about that stuff, because maybe there's a deeper health issue that's going on that your eye's trying to let you know that there's a stress-filled trigger that may be inciting all of this, that may be kind of promoting this just a little bit more. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.